Welcome to the Mindful Table with Health Empowerment Coach Joanna Mickel and myself, Dr. Maame-Mensima Horne, naturopathic doctor and clinical hypnotherapist, where we discuss natural approaches to health and wellness with an emphasis on being mindful. Today's episode, we will discuss stress-induced illnesses. This is a topic that came to mind after working with a patient who was diagnosed with prediabetes and was very concerned of blood sugar dysregulation and insulin resistance. And so after doing some lab testing, there was not an indication of actual insulin resistance. But when we did a further digging, and especially the history, chronic stress was actually the cause of their illness. So today we're going to be talking a little bit more about how stress impacts our health. And before we get started, I just wanted to kind of set the tone as far as why stress is such an important aspect of our health and how it impacts both chronic and acute care. So, stress, as we've discussed in the past, it results in the release of hormones. And there are two different types of hormones. There are the like cortisol based hormones, and then we have the catecholamines, which are like your fight or flight hormones. So cortisol is what is usually our first response. And when we are running or we need to like get away, fight, things like that, we have the epinephrine, adrenaline, as we call it, and that gives us the energy to keep fighting, keep moving, run miles, get away. So, what is different about today versus when when we first showed up on the earth is that our environment keeps us constantly secreting these stress hormones. And unless we have really good systems in place to mitigate stress, then we are at risk for a lot of conditions because cortisol, especially, affects our immune system. It affects our metabolic system. And of course, it affects our nervous system. And so do adrenaline. We know that epinephrine is what, like, it's a major nervous system hormone. And these hormones are the issues. And they're not really issues, they're part of our survival. But being able to manage our stress in today's time is so important in order to prevent diseases, whether it's metabolic syndromes or hypertension or even cancers. So I'm going to open up the conversation for Joanna to kind of share a little bit about her understanding, her approach, because Joanna's a great educator and but she also is a health empowerment coach and does a lot of stress management as a part of her treatment support.
Yeah. Yeah, because those are the three pillars that I use as a health empowerment coach is addressing nutrition, fitness, and stress management. So stress management is to me is the crux of it all. Yes, we can easily get our nutrition under control, we can get our fitness plans in action, but the difficult part comes when we get to the stress management piece because this one is a more um, tricky area because it goes into how we, that nature versus nurture response of the body. Again, it's about survival. Stress management is about the body's feeling of being threatened, right? So it's about survival. So cortisol is kind of the long-term stress hormone, whereas epinephrine or adrenaline, however you want to state it, and norepinephrine are in the acute phase. And of course, acute phases come and go while you're in a chronic phase. That's the thing is as we go in and out, and that can happen with any chronic illness. You'll have an acute phase on the illness, and that's really we really have to kind of watch things. It can be detrimental, but the acute phase of what we used to have years ago, like I said, we were in a different stress environment than we had years and years ago. When you're truly being chased by a bear. You're the prey and they're the, or in the other sense, you can have the same acute response when you're the hunter, and you need that. So you need adrenaline to be able to chase down whatever it is you got to get, because it's for your survival. You have to get that bear so you can eat, and vice versa for the bear. And so in that time, that adrenaline is very important, and that cortisol. And so cortisol has a part in, and if you don't have cortisol, it can kill you. So that's why it's so important that we have cortisol in the right amount. It's part of our circadian rhythm. It's our wake up hormone. So if we have too much cortisol, our sleep hormone, which is melatonin, doesn't get to do its job. And that's why a lot of times when we have chronic stress, we have insomnia. And we're tired as all get out, but our brain cannot shut down because cortisol is keeping it awake, because it thinks the bear is still there. If you go to sleep, you're dead. Bottom line. So that's kind of like a simple way of looking at it. And so what we have to do, and what I work with and with my clients, is getting them to understand what is the cortisol flow that it should be, and what are some signs that you can start looking at that your cortisol may be elevated. And then what are the things, when you notice that your cortisol is elevated, is how do we start finding what is the bear on your back? What is it that's sitting there, and how can we shift your body away from thinking it's being threatened by a bear? And of course, the bear is just the figurative stressor in your life, whether it be your boss, whether it be a relationship, whether it be bills, lack of funds, the list goes on and on and on of what those stressors or bears are to the body, because the body doesn't see any difference between a bear and your bills. It's still a threat to your survival, so to speak. And so the body goes into that. And so maybe we need to talk a little bit about, again, we probably talked about this before, but going into that sympathetic and parasympathetic tone, because that's where it gets. And that's where cortisol, if it's up, we're turning on switches, right? That's what hormones does. It turns on genes for survival. The thing is we leave them on too long. And so let's talk a little bit about that. How do we take into account the sympathetic tone and the parasympathetic tone? And how does getting the sympathetic tone left on too long lead us to chronic illnesses? Because this is what, I usually talk about with my clients, and maybe our listeners might want to know a little bit more about how does this, what is cortisol's response in the body?
Yes. And before we go there, I did have some thoughts. So, as a naturopathic doctor, we're able to test, right, and
Yeah.
assess different times of the day through our functional lab testing, and also, yeah, just lab testing in general, different times of the day where cortisol levels are high or maybe they're too low. Like in the morning, it's the time that your cortisol should be the highest. And then it comes down. And then again, when you're going to sleep, it should be the lowest. So there are assessments, ways to test and assess where your cortisol levels are throughout the day. And through testing like that, we're able to we can make more informed decisions as to, okay, so this is what's going on. But even when we're looking at just cortisol, in my training, I learned that you kind of, there's usually the hormones, like we have the adrenal system, but also the reproductive hormones and the thyroid hormones. They're all a part of the same system, right?
Yeah.
The
And they
system.
have a lot of the same precursors, and that's where we get into the little bit of problem. Yeah.
Yeah, is there, well, yeah, and they're stimulated
Long
by
term.
feedback. Yeah, so there is like the feedback mechanism where they actually can play a part on each other. And they all are, whatever is happening at the highest level, the hypothalamus, will impact what's happening at the pituitary gland, which secretes a precursor for, or a stimulating hormone for the actual target hormones to actually be released. So as the different hormones, especially what I've seen, cortisol, when cortisol is over releasing, what I've seen is how it impacts the rest of the organs, right? Because on each of our organs, there are receptors for each of those hormones. So we may say, oh, these systems are not related, but they are interrelated. And having the appropriate balance is so crucial. So yes, as we start talking about sympathetic tone and parasympathetic tone, it kind of gets me back into that yin yang conversation.
Absolutely. Mm-hmm.
where we're used to go, 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 do, do, do. We have to survive, right? In order to survive, we are perpetually in a sympathetic dominant state.
Yeah.
And when there are times of stress, whether that's economic stress, whether it's political stress, when you don't feel safe, and I work a lot with patients who don't feel safe in their bodies for different reasons. And when you're not feeling safe, usually your sympathetic system is turned on.
Mm-hmm.
So when we talk about healing, most of the work that we're doing, because you do have some people who are kind of stuck in a parasympathetic dominant state, and their treatment approach will be a little bit different. They need a little bit more of that sympathetic stimuli in order to get going. So it's kind of like if you think about an anxious person and then a chronically depressed person. That anxious person is like kind of always on,
Mm-hmm.
and having ways to kind of calm and slow down, versus somebody who is chronically depressed where they're just kind of not, they need to be turned on.
Mm-hmm.
And our nervous system is kind of like that. You have the system that keeps us going, and then you have a system that they work together, they're intertwined, that helps us to chill, to digest, to heal. And healing happens in that parasympathetic state. That's when our body's able to restore and repair and build.
Mm-hmm.
That's when our digestion is rest and digest. Our digestion happens because we actually are able to rest. So having that balance, and I know especially when, as you're talking about survival, the means to survive is a lot different these days, right? And like what we're trying to survive. It's not like, oh, okay, I'm gonna go hunt because I need to eat, but like I have shelter, whether it's I made the shelter, it's temporary shelter, we're like living in trees or amongst trees, or we've built a little hut or a house or whatever, and we can kind of come and go and forage and all of that stuff. Right now, it's like we got a house, we got a car, we got all these things, we got responsibilities. How do we
Mm-hmm.
like take care and educate the children? All of the things that come with modern civilization. And then also maintaining relationships,
Mm-hmm.
right? Because that's a major stressor for a lot of people.
Mm-hmm.
And creating healthy relationships where we're not constantly in that sympathetic dominant state. So I think, yeah, so like talking about it from that perspective where we do need to be able to show up and be productive, make
Mm-hmm.
things happen. But at the same time, we need to be able to take a breather, relax, and enjoy aspects of just living.
Mm-hmm.
And with that balance, that is where we're able to experience the that silver lining of health. Because as you said, the nutrition and the fitness, all of that are supportive
Mm-hmm.
in my experience. Because I mean, I've met people who don't exercise. Their exercise is going where they need to go.
Yeah.
And they eat well, and they don't overeat. They're not like the strongest person, but like their their health is imbalanced or more
Mm-hmm.
balanced than someone who may be like over like I gotta get these exercises in, I gotta eat like really healthy, and all the like the
Mm-hmm.
more pressure, because there's
Yeah.
pressure in that.
Yes, there is. Yeah,
Yeah,
absolutely. Yeah.
so those
I've
are
seen
the
it.
aspects. Yeah, I do too. Like perfectionism
Mm-hmm.
is
Mm-hmm. Mm-hmm.
perfecting, like controlling
Yeah.
how you eat and exercise and being perfect in every
And that's
aspect.
why they call it orthorexia, right? And
Yeah.
the thing is, it's not the eating healthy that's the problem of orthorexia. The problem with orthorexia is that you're obsessing over it, and you've now created a stress response because now it's becoming, "Oh, if I don't do this, I could die." That's what the body thinks, and it creates that stress response, right? So you can be eating healthy and exercising, but the problem is the thought process towards it becomes pathological, and
Yes.
there you have the problem.
Yeah, so orthorexia, just for people who don't know, is essentially a disordered eating pattern that is obsessed with healthy choices.
Yeah.
And I know when we were in naturopathic medical school, I mean, it's a joke, but it's also not a joke. But the joke is that like almost everybody in our educational system has gone through orthorexia at one point of our our training or even in our lives, because we want, and I see it with patients, it's like we don't want to be ill. We
Mhm.
want to not succumb to some of the lifestyle diseases that we see in our families. And because we know it's based off of lifestyle, then this is something that we can control. And the narrative is like, well, yes, you can control this, eat healthy, exercise, all this stuff. And then the pressure of doing that actually feeds into the disease process.
Yeah.
Yeah.
And so it's finding that balance, right? And that's one of the things I talk about with my clients, because I see that when you're trying to get them to eat healthy is they start over obsessing. And so then I have to talk about, okay, I like the 80-20 rule, because that gives you place to have those things that are considered bad. Plus, I also say it's your choice. And the thing is to take it with an informed consent. Basically, is when you choose to eat things that aren't necessarily healthy, like pizza and a burger, or you go into a barbecue with friends, you know, and people obsess. So I'm going and they're not going to have anything healthy. And I'm going to say, you know how to party at your house, it's going to get dirty. You know how to clean it up, don't you? Well, yeah. I said, that's the same with your body. It's okay to have a party every now and then. Just know that tomorrow you're going to clean it up. And if you take that thought process that it's okay to every now and then have a party, it's not going to, affect you long term, only if you continue in those habits. You're not going to party in your house all day long and then your house becomes a trash wreck because you never give it a time to actually clean up the house. And so that's the thing that gives us back, that take us out of the stress and back into parasympathetic, so we don't end up in those cycles, is to learn that it comes down to our thought processes and that balance, like you say, between the yin and the yang. Sympathetic is that yang position, the yin being parasympathetic, and we have to balance between. If we're totally parasympathetic all the time, like you said, that's going to be pathological or problematic. And then you have the sympathetic too long, that's problematic. So it's that easy switching back and forth, what they call agility. Like if you have heart rate variability, we talked about, it's that easy agility to be able to switch back and forth between the two sides that gives us that ability to survive, to repair, and then to be able to, meet the foe and then say, the foe's gone, I'm good. So you can go to sleep at night, right? We want to be able to go home and sleep.
No, and to kind of support what you're talking about, Dr.
Yeah.
Mona Morstein, she's a naturopathic doctor who wrote the
Mhm.
book Master Your Diabetes. She actually talked about, even with patients, having that 80-20 kind of mentality, where
Mhm.
there's one day a week where you give yourself a treat. And
Right.
I found, for me, that's how I got through the prereqs to get in, like to get this far in our education. Um, was like I had a thing for cupcakes, and they were
Mhm.
gluten-free, vegan. They taste so good. And during my when I was studying for my prereqs, I every week, if I did what I needed to do, which was I studied, I killed it on those exams, and I kept showing up, I would go to this cupcake. I think it was Cakes by Holly, but it was really good. And
Mhm.
I would just treat myself once a week, and I would share it with other people. And it
Mhm.
was like that thing that I did for myself. And by giving myself that aspect of sweetness, that allowed me to actually do what I needed to do and push through, endure.
Mhm.
Because, and I mean, it doesn't have to be like sweet treats, right?
Mhm. Right.
Um, like yesterday, I went to a concert. I like rarely go out, but I went to a concert and it was like, it revitalized me. I went hiking today. I had like the nourishment that my
Mhm.
body needed, and or not just my body, like my soul. I was just
Oh,
nourished. Yeah, and that is what like allows me to be more productive, right? Allows me, because I have cultivated and made space for me to spend time in my joy.
yeah.
And when we're
Mhm.
talking about foods or in health, having that balance, and it can be, I mean, the concert was gifted. It wasn't like, oh yeah, someone's like, oh, I have extra tickets, they're free. I'm like, well, yeah, I'll do it, right? So it's not even like I was splurging. It's
Mhm.
just like I took an opportunity that was presented for me to go out and experience things that I find joyous.
Mhm.
And that kind of practice keeps us, it's like it took, I know for me, I know it took me out of that mentality of like, I have all these things to do. I have to achieve this. And
Mhm.
it just gave me like, it gave me some freedom, mental freedom, so that I can actually reprioritize my needs.
Mhm.
Because I see that working with patients, and these are conversations that I have with my patients, right?
Mhm.
It's when we are trying to survive, or even if you're thriving, you're trying to grow, or you're trying to improve, or you're whatever, fill in the blank. When
Mhm.
we are in that doing energy,
Mhm.
there are times where, going back to the initial, when I was talking, this came out of a patient encounter. So that patient, I mean, I'm impressed by them because they put themselves through school as a single parent. And the amount of, like, they didn't stop for 30 years because you have to take care of your children and build a solid foundation, right? So for 30 years of enduring high stress performance, in order to not just, like, no one just wants to just survive. We're trying to thrive and have a level of peace. But when your life has just been like pushing, 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 when is there time? When do we actually make time for the things that we enjoy? Because the more that we actually make time for that, then we're able to actually regain and restore health.
Mhm. Mhm.
Yeah.
Yeah. Yeah, and I think that a lot of times we don't give ourselves that opportunity, to just chill, have an enjoyable moment, right? I got to do this. I got to. It's always, and when we do go to sit to chill, we get, anxious about what we need to do. So we're never in the moment. One of the things I like from one of the books I read, um, can't remember because they kind of all kind of crossed over each other in the mind body part of what I'm doing at Quantum University, and where they talk about being in the moment. It was one of them was talking about when you're washing dishes, wash dishes. People are like, what? I got to wash dishes. I'm like, I don't want to wash dishes and think about dishes. He says it's about being in the moment. It's about being present with whatever activity you're doing, removes the stress.
Mm-hmm.
Because if you're doing dishes while you're thinking about, I got to do laundry, I got to do this, I got to do homework, I got to do blah, 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 you're creating a compounded stressor because now you're anxious and you're running ahead and the body's, you're just building up and building up all the things you need to do rather than just enjoying the moment you're in, whether it be washing dishes, enjoy the feel of the water, the smell of the soap. Hopefully you got a nice, aromatic essential oil type. Um, it's good for your skin. Uh, anyway,
That
but so and that kind of hit me. I'm like, wash dishes. If you're gonna wash dishes, he said, wash dishes. Don't be washing the dishes while you're doing all these other things. And he said, and that's the same as when you're in the moment of whatever it is you're doing. Say you're spending time with your family, sitting at dinner, or you're, you know, I don't know, whatever it is you're doing, that activity, be with that activity. Don't let your mind wander outside of that moment because then that creates the stress response. So it helps to bring you back to that parasympathetic state because you are in that moment. So like if you're on vacation, stay on vacation. Don't think about what's going on at home or what's going on here, or what's going on there. And that way you get that full experience and be able to shut off that stress response and go parasympathetic in those moments. So that again is a tricky thing to do. I've tried. I'm still working on it sometimes myself even as a practitioner, and a health coach. We're always trying to do these things, and so it's really helped me though, to be more present and to realize, yeah, I was always over there. Because if you're ever driving down the road, and we have a lot of distracted drivers, why? Again, they're not driving; they're off somewhere else. If you've ever been driving and all of a sudden going, "Oh, how did I get here?" Because you weren't there, you weren't driving. Your mind had already gone to work or gone over here or did this, and it's on subconscious mode. And thank the Lord, we have a subconscious ability to drive and think somewhere else. Because if we didn't, and sometimes it does happen. We get so caught up in wherever we are That's why we end up being distracted enough to get into accidents, because we don't see things. Our mind and our inner eye is already seeing something else. So that's one thing to think about, guys. So you can have be a safer driver, be driving.
No, I
So
love how you shared that because I was introduced to that when I was studying yoga. The Heart of Yoga by Jessica Char, I think, is where that idea of being mindful
mhm,
and eating mindfully and doing things mindfully. And then also, I was like I really love Korean medicine, and I've been watching some lectures on the Korean medicine, traditional medicine use application for treating mental health. And for depression, they actually talk about walking meditation. And I was
mhm,
introduced to walking meditation when because I practice Buddhism, and I went to one of the Buddhist temples that I visited. Part of the practice was the walking meditation, right? And so, like, as you're walking, you're just being aware of what is going on around you. And then they add a twist because one of my classmates said that, Koreans love to eat, but specifically, if we're thinking about it from like a five elements Chinese medicine perspective, there is a spleen qi deficiency. So that what that means is the energy, the spleen and the stomach work together. Those are paired organ systems. You have the yin organ, which is the spleen, and the yang organ, which is the stomach. But when we eat food, we think, oh, the food goes straight into our stomach. But from an energetic in the East Asian philosophy, the the food goes into the spleen and the stomach to be transformed so that it can be made into chi. And the energy from the food, we call it gucci, that chi actually is used and combined with our original chi. So the chi, the energy from our kidneys, which is what we're born with. So we think about like our DNA or whatever it is. But that's the chi that we live with. And that combines with the food and the air in order for us to have the energy. So this is like, if we're talking about a Western perspective, this is like our metabolic system, how we transform food and air into energy. With the idea in Eastern philosophy is that, or East Asian philosophy is that the food and the air and the water have to actually blend with the chi that we have, and that ability is how we go. So when you're working with someone with depression, you want to nourish their spleen chi, so you want them to eat, but you
mhm,
also want to get them moving, and you want them to be aware of how their body, because when we're walking, we have to be in balance and we have to do all these things. And we also have like to get where we're going.
mhm.
So walking to eat is a way that is, I know, it's like being mindful. So a
Yeah.
walking meditation with a destination that is nearby so
Mhm,
that you can go and do something
mhm,
and nourish your body at the same time, not just
mhm.
depleting. And so when I was thinking about that, I was like, wow, that's kind of genius because like you're actually engaging this person to kind of stimulate an aspect of doing, because we talked about when you're more depressed, there's more of a parasympathetic and you need some type of stimuli. So the walking is that stimuli, but
Mhm,
also maintaining an aspect of that parasympathetic aspect because you're mindfully walking. And
mhm,
then when you get to eat, you're going to enjoy your food by being mindful and being present with the food, re-engaging your senses, the five senses, and hopefully the taste, right? Because all tastes actually stimulate receptors in our bodies. So there's like, I mean, I'm kind of biased, but the argument is when we're taking herbs or we're eating food, having food by capsules, yes, you may get some of the there's a benefit to just getting, the medicine, but part of the medicine is in the taste because those tastes have receptors. We learned during COVID that there are bitter receptors, or I learned during the COVID pandemic and some of my training, bitter receptors in our lungs.
Mhm.
And so when we think about things like that from that perspective, our tastes stimulate our body and it's healing. And so being able to mindfully eat, mindfully take in what we have made. And if you have the smell of the food, so making your own food, they talk about it in the Heart of Yoga, the importance of making your food, because while you're doing that, you're actually, I'm just thinking about it. I mean, obviously visioning this also helps, but like you get the aromas and all of the senses, and then it actually stimulates digestion. And
Mhm.
a lot of people have digestive issues. And so by engaging, we're actually stimulating our body systems. And then when we're eating the food, especially bitter foods, it is actually helping to support our digestive system so that we are building the proper pH in our stomach so that we
Mhm.
can actually properly digest the meats and the fats and the carbs, everything.
Yeah.
So like yeah, so when we're talking about mindfully doing things, there's actually support in the science of from the Eastern philosophy. I mean,
Mhm.
I kind of brought into the Southeast and then the East Asian philosophies on why we do the things that we do, because it does have a sympathetic and parasympathetic balancing act there.
Yeah.
That is what we need.
Yeah. Going into that with taste is, people think, oh, I do Diet Coke, because especially we were talking about sugar dysregulation. What they don't understand is our body preempts based upon our taste. And
Mhm.
so it actually acerbates a diabetic conditions or pre-diabetic conditions because of the sweeteners that they use. The artificial sweeteners are 10 to 100 times sweeter to the taste buds than the normal, using honey or maple syrup or whatever, even just regular sugar, and that initiates the system like, oh, I got a lot of sugar coming, and so the body actually preempts insulin based on your receptors, and what ends up happening is it creates a quicker response, and that causes hunger later because the sugar drops so quickly because of that preemptive nature of the body with this sugar receptors in the tongue, and it telling the system, because our body is always preemptive, because why, that is a way to be to make sure that we survive, right? It's the way the tongue works, and the body knows that too much sugar is a detriment to the health. And so if you have something that's going and being taken the taste buds, oh, we got 10 times blah blah blah, or 100 times, you know ooh, we better be ready for this. And then there's no sugar because it's not a sugar. It's just a molecule that's highly sweet, and it's a chemical. And then we have to detox that chemical through the liver. So that makes you be aware. Yes, taste is very important to the body system. The other thing I was thinking about when you were talking about the walking and meditation is, you're going on the five elements and stuff like that, and that walking is actually for liver qi stagnation.
Mhm.
So, and depression is instigated in through liver qi stagnation. So that walking is a great thing. And of course, with meditation, you're kind of reducing the thought process, which is the spleen,
Mhm.
right? The spleen does the worry and the stuff, and so we're kind of reining in that, which can lead us to the the chi deficiency there, and then the stagnation to removing it. So it's really great for the digestive tract as well. Um, and of course, the spleen in Western or in Eastern medicine actually encompasses the spleen and the pancreas.
Mhm.
And that's why it's in that transformation, and why it's so important for the spleen and stomach and that deficiency. So, a lot of spleen conditions are associated with what's called wasting and thirsting disease,
Mhm.
which is diabetes and prediabetes, which is the pancreas, which is the spleen. Because people have spleen, well, in Eastern medicine, those two are together, and if you look at the anatomy, they're kind of stuck together
Yeah,
through
yes.
the
And
ligament.
they also, what's interesting is so for us, we know that the
Mhm.
spleen is part of the immune system,
Mhm.
which is also part of that Wei Qi, like the defensive
Mhm.
system.
Mhm.
So being able to build the blood, right? Because blood
Mhm.
goes through the
Like
spleen, but
this.
also like, I mean, yeah, it's really interesting how, I mean, it's how the ancients, because this is like really 2000 old medicine and they didn't really do a lot of dissection. So how the ancients came up with these systems of understanding the body that are actually relevant. And now we have more information. So by utilizing what we know in Western, like the biomedical sciences in general, allows us to kind of extrapolate the importance. One of the things that just came to my mind as you were talking about sugar and diet sodas
Yeah.
is high fructose corn syrup.
That's it.
Because one of the things so when we talk about sugar metabolism,
Mhm.
learning that fructose does not actually get metabolized in the same way that glucose does.
Yeah. Yeah.
So fructose bypasses.
Some of her. Yeah.
Yeah, and it just goes, it can go straight to the liver.
Mhm.
So when we have this chemical molecule, because fructose is found in fruits,
Yeah.
it is the sugar of fruit. So when we have this modified version of it, our bodies don't know what to do with it, but it's not being converted through the normal Krebs cycle and all of that. It's going straight into the fructose, like getting converted in the liver, and then we have fatty liver because it actually, like if you have too much sugar that's not being metabolized, it gets stored.
Yeah,
And
and it doesn't turn on insulin, and so that's where the liver doesn't know what to do with it. It just gets all this fructose and says, "Well, I'll convert it to glucose and I'll make it into fat because I don't need it over here." And after that, what do? I don't know, because the liver likes to follow its direction, which is usually through insulin and glucagon, and
yeah,
insulin's been triggered because fructose doesn't do that, and so it's sitting there going, what do I do with this? And so that's what's led to a lot of children having liver conditions before they're hitting 20 because there's so much high fructose corn syrup in the processed foods and the foods that are out there, and that instigates stress in the system. I know we've kind of gone a little sideways with our
no, but it's
thing, but we're kind of
important.
getting there. But it's very, yeah, it's
You know,
definitely very.
one of the things that you said earlier that I think is important to highlight, because this is
Yeah,
one of the things that I ponder on all the time, is
yeah.
what we call stress.
Mm-hmm.
Stress
Right.
is everything, anything that our body has to endure is a stressor.
It
And
couldn't.
there's a fine line.
Yeah.
What can be a stressor can also be the thing that brings you joy. So food is a stressor. The wrong food,
Mm-hmm.
not, I want to say the wrong food, like, yeah, foods that are not the best for our bodies cause stress because our body has to detoxify it. Like you said,
Mm-hmm.
the liver usually gets taxed, which is how, when we're talking about, so liver chi stagnation is when the energy of the liver to be able to metabolize and do its work is stuck.
Mm-hmm.
And it can
Yeah.
be stuck for a lot of reasons. Emotions are usually one of the main reasons that the liver chi kind of gets stuck. It congeals, and
Mm-hmm.
also too much cold. There's so many things that can make
Yeah.
it
I mean,
kind of get stuck. But when we're talking about stress, we talk about the adrenals, but we also have our body has to like actually break down all the byproducts of everything.
mm-hmm.
And the liver is the metabolic house of our body, because if we need an energy need in our bodies, especially when it comes to our brain or vital organs, the liver is going to say, okay, look, I know I have this glucose. I'm going to prioritize what's vital so that you can survive, which is why
Mm-hmm.
you have people who get like Raynaud's syndrome, where their circulation to their extremities is less and chronically, and it's usually due to stress. People say, oh, yes, when you get stressed, your body is prioritizing survival, which is the core vital system. Yeah, so like, it really is. So when it's stress induced illness, like stress is a major component of life, but it
Yeah.
is that one thing that there are things that we can control, there are things that we can't, but it impacts every organ system because
Mhm.
they work together
Mhm.
and they're not separate systems.
No, that's yeah, like you're saying. So stress, if we want to get into well, not really a definition, but one of the things we talk about and get in my program is there are three types of stressors. There's chemical stressors, physical stressors, and emotional stressors. And all do the same thing in the body, because it's a question of, does the body feel threatened? Does my survival feel threatened? And it creates a stress response, whether it's coming from a chemical stressor, which can be your food. Like we just said, if you're drinking soda, I'm going to tell you, there's a chemical stressor in that. High fructose corn syrup. It's a physical stressor to the
Alcohol,
body.
tobacco,
All
everything.
of yeah,
Even
physical stressor,
medicines,
pollution,
herbs,
herb. Yeah, yeah,
medicine,
yeah,
drugs, all of
yeah.
it. It's a stressor.
Yeah. And so the body has to say, okay, how, the liver, I call the customs broker of the body, because most everything goes through the liver to get checked out. That's why you have certain medicines that are first pass, second pass, right?
Yep.
To see, is it going to be medicinally active after it goes through the liver? Because the liver is going to detox it. And so, or it's going to change it. And it's like, okay, what's it going to change it to? And is that going to be able to do what it needs to do in the body for health? So yeah, it's a physical stressor, and it's going through that. So the liver gets a lot of stress. And I say, my poor liver, especially when I was younger and all I knew was, pain medications for the certain things. So it had a lot of aspirin and ibuprofen and all that stuff. And I'm like, my poor liver. And
Yeah.
it's lots of help now. So, and then your physical stressor is your exercise. It's you're going about your day. It's if you get in an accident or you have inflammation in the body. That's all a physical stressor. Again, it's going to do the same thing. If you over exercise, you're going to have burnout. Or you're going to have, you're going to be fatigued. There's things like that. And your emotional stressors. That's how you see things. And like you said, there's a thin line between a stressor and a joy. And it's what it comes down to is, how are you perceiving it, right? Like
And
some people like me, huh?
quantity,
And
quantity.
quantity, yes,
Yeah,
quantity too. Absolutely,
we
yes.
can love things. I mean, like there are people
Yeah,
because of mental health work, the mind,
yeah,
body, and mental health
yeah.
kind of go together. When we're looking at the what makes an addiction an addiction, we know that we're all trying to cope, right? And how we
Mhm,
cope is
mhm,
really how it kind of sets the framework of our health.
yeah,
So something like having a glass of wine for some people is a
mhm,
joy.
yeah,
And if you have one glass of wine, okay, not so much a big deal for some people. Some people, one glass is enough to like set them off. Um, but our body still has to metabolize it. And if the body, so for example, glutathione, if we're stressed in
mhm,
general and our
yeah,
glutathione stores are already like limited,
depleted. Mhm,
that glass of wine can be the difference between your body going into a deficient state or a very taxed state and inability to kind of
mhm,
like an unhealthy state
mhm,
versus it being able to work as it is intended to.
mhm,
So to me, it's about quantity. It's also about understanding your body. So like
mhm,
before, I wasn't really into genetic testing because I was just like, nah. But then now, because we all have different ways of living and
mhm,
working in mental health and with patients. I mean, I work with patients and a lot of patients have mental health issues. So it's not that it's not like I'm like, oh, I just want to do mental health. It's just like, this is a real thing for a lot of
mhm,
people. But seeing how our genetics actually can play a big part. And what I find fascinating is like, for example, from a East Asian medicine philosophy, we
mhm,
know that there's so many ways, like if we're looking at the organs, you can have the liver yang, so like the liver sympathetic system energetics just rising up, creating a
yeah,
lot of
mhm,
issues, and then that creates some mental health issues. And
mhm,
then you have people who have like a lot of inflammation, neuroinflammation causing the issue, and we'll call that like phlegm misting the mind or misting the
yeah,
heart, right? Orifices of the heart. So there's so many ways that we can look at mental health.
mhm,
And what I've noticed is that when we're looking at it from a genetic perspective, if your glutathione depletion happens because of a genetic SNP, and if you are stressed, your body is not actually creating and replenishing glutathione to the same ability. That person is going to have, so we talked about first phase, second phase, or past metabolism in the liver. So that person may actually have these neurotoxins in the body because their body, and we see it with drugs, right? So you have the drugs in their active form, but these are still toxic and the body has to get rid of it. So if glutathione is not working efficiently because it's like, it does the redox, oxidation reactions, right? So if it's not binding it so that it can be released through urination or however it's going to go out, usually through urination. But if your body's not able to process it, then you have toxic things just going in your body. And those toxic things can go through the blood-brain barrier because a lot of them are they're fat soluble. And then they're going through the blood-brain barrier, and then you have mental health symptoms. But those mental health symptoms may be attributed to the liver not being able to handle detoxification of stuff, stimulus, I don't know, like of toxins. So
Yeah, and then the thing is, with processed food, we got all kinds of stuff that's coming in, and that's why we're, as natural practitioners and holistic practitioners, we're trying to say get away from those things because it's taxing our liver, and the same with any stimulating substance, caffeine, sodas, and even herbs, there's things in there, and of course this is where we have issues with drug overdoses and things that may not necessarily be a drug overdose in a normal state because, like you said, we can't metabolize it. Our cytochrome P450s and other pathways are stunted. And there are people that don't have those enzymes in a high amount, like you said, doing the genetic testing. And what is it like? For me, my body, I'm going to tell you, my liver doesn't do good. I can't do medications because they make me, I go, wee. So like Mucinex, Benadryl, you have those people that go, wee.
yeah,
and those are people that tells you that their liver doesn't detox that. It does not have the pathway to properly process that. Those substances, and therefore it leads them to those side effects. That's where side effects come into play, is people not being able to metabolize them the way the general population of the studies was able to do.
Yeah.
Right. Because it's different. And, so it is a thing that we have to understand as individuals. What are going to be my stressors? What are going to be? And that's kind of what I talk to and giving indication with my clients is how do you start noticing what is going to be my, like, for even exercise, like you said, exercise, what you had said is the amount, because I had said, for emotional stressor, it has to do with, how we think, which that is part of it. But again, amount, that's very much the case, is amount can play a role on that fine line between being a stressor and being something that's beneficial to you. And when it comes to exercise, there is that line too. I was the overdoser because I love to run, and I went a little too far with that. And I see it a lot with my A blood type people, and they have to really watch the fine line because they are so cortisol sensitive that when they go over the line of their fitness, it'll actually stall their weight loss, and it'll cause and you can see the stress response by the way their body composition shifts. And it's just like that if they just hit right over it. Us O's, we sometimes can be overdoing it, and it's not going to have as bad.
We actually need high intensity exercise,
right? And
in
so
order
we have
to get the results.
Right. And so it's like, and I'm like, I said so bad. I have to do all this work, and they don't.
Well,
But it's frustrating to them too, because they're on that fine line of, okay, I got to figure out, okay, if they love something that's pretty, and I've worked with them, they like to do like things like Orange Theory and CrossFit, and they're staying heavy, and they're like, I can't lose any weight, and I'm doing this. And I'm like, unfortunately, you're gonna have to back off. And they're like, I like it. I said, unfortunately, your body doesn't.
Yeah.
I said, you can do it, but you're going to have to find where is your cutoff point, you know? And that's the same with, I like to, I don't, let's say if you like to do a lot of socializing where, and I'm going to stay up late 5 days a week to go socialize, which I don't do that because I'm a early to bed, early to rise kind of gal. I would be like sleeping at the party. But, there are people, I worked with somebody who loved to dance, and she kept going out and dancing. I'm like, you can't dance every night. you got your body, and she was hitting that overstep, and it was causing her some insulin issues. So I'm like, you're going to have to back off,
Yeah.
and and so that's the thing is where is that line that we have to do between something, yes, it makes you happy and you really enjoy it and it can reduce your stress, but at the same time, when you're overdoing it,
It
the
can
stress comes in, and now you're creating those cortisol responses, which creates the insulin resistance, which creates the metabolic dysfunction, and as we say, stress creates into these health conditions that we have to go and say, okay, how do we bring you back to center stage?
Yeah, the beauty though is like for those of us who are sensitive to medications, you being
Mhm,
one, I know I am as well.
mhm,
What I found in naturopathic school was modalities that were they actually helped. So that's how I got into some, I kind of do a little bit more of the eclectic stuff, what they call the
mhm,
vitalistic, because, we are energy
mhm,
and we resonate at certain frequencies. And what I've found is the more that I attune with my higher self,
mhm,
um, I find that I'm more sensitive to medications.
mhm,
So, like homeopathy is one of those. It is energetic, but it does have a physical. Like if you could look at the studies and you can see how it does have an effect on the immune system. It's
mhm,
not one to one. Like everybody who has this gets that. And
mhm,
we were talking about it before in our own private discussion. There's a remedy that I use, like I guess constitutionally, meaning when I am out of balance, this remedy helps to bring me, it's one of the remedies that brings me back into balance. Kind of depends on how did I get, what is
Well,
it?
yes, yeah.
Exactly. Because when you're talking about the social aspect, like I am very extroverted, even though I've become more of an ambivert over the years, more introverted, but I'm an extrovert. I get most of my energy by being out with others. And so when I'm like over, like when the world is kind of frazzle dazzled and then I'm feeling that frazzle in my body, like there's a remedy that I take because my sympathetic, I know my sympathetic system is just frazzled. But being able to identify constitutionally where my disturbances are. And I know, for example, we talked about five elements. Yesterday we were talking,
Mhm,
and you were mentioning, oh my gosh, this is where she was telling me where I felt, like what she knew I felt and what
yeah,
I felt, because I feel that I have a lot of fire. I'm more fire versus earth. But like if I go to some people who don't know me,
mhm,
they're going to treat me from an earth perspective, which helps. I do
mhm,
have a lot of the mental activity,
mhm,
but I'm super passionate. I'm a fiery, fire girl with a lot
mhm,
of earth, right? And so being able to identify constitutionally what a person's, I guess, the constitutionally where they fall, you're able to preemptively
mhm,
know where there is susceptibility, where their weaknesses are, and you can help support. So I know in East Asian medicine, we do a lot of tonification. You know what to tonify, but you also know what to sedate, which is to bring down. Because I know for me, I'm that person. Like if I have too much joy, that I'm, it's like it's the heart, right? The heart loves. We know the
mhm,
heart is full of joy. It has so much love. But too much love, even too much of a good thing can be
too much.
exactly, and it can become pathological.
Yeah.
So, using that as an example, too much joy can actually create what we would see, like you can find it, you can see mania, you could
Mhm,
see other things that occur.
mhm,
Anxiety is a big one. You
mhm,
get like occasional heart palpitations, all of these things that we can see are symptoms.
mhm,
And so being able to know, okay, like for me, I know like my thing is joy. So I need to just chill, like chill, like chill, like go in the mountains and sit by myself.
Mm-hmm. Yeah, I'm all for that. Definitely, I was going along with you with that constitutional, because like I do constitutional homeopathy too. I'm a nux vomica, which is a wood. If you want to get into the 5 elements, I'm a metal in wood. I'm mostly wood. I did have my metal was a little out of balance years ago, but I still have some metal in me. But mostly I'm a wood, and nux vomica is very wood. So I have to do a lot of movement because wood is a moving type. We're about going. We can get easily frustrated if somebody steps in my pathway. I'm supposed to be growing, and so we're kind of an aggressive group. But it shows you, and that again is why I have issues with liver, which liver does the detoxing, because liver is the wood element of the body, liver and gallbladder. And so I have that aggressive nature, anger, resentment, don't get in my way. A tree's going to take you out. If it's going to grow, it's going to go right around you. It's going to find a way.
That's true.
And so, we have to kind of be aware of that, our temperaments, because again, it's going to show you what are going to be the things that's probably going to be your stressor. Like for me, again, if you're getting in my way, that's going to stress me out. If something gets in my way, that's going to stress me out,
Yeah.
and that's, and when you start seeing people's constitutions and stuff. And so when I get out of balance, and it's usually the first sign of me out of balance or any wood out of balance is irritability. That's the first thing. And that's, whenever you're doing in Chinese medicine, you have to diagnose. And usually that's one of the symptoms of a liver condition is irritability. So, liver's involved, they're irritable. If they snap at you or I know our mutual friend, Dr. Alicia, she always, when I'm on the phone and I'm talking about something, I get snappy. She goes, have you taken your nux vomica today? Because we use it as a support, because the thing is that's what keeps us from getting these stress disorders that later down the road that develop into a disease. Is we got to catch ourselves in those imbalances. So when we start knowing our constitutions, knowing our susceptibilities, whether we do it through genetic testing, whether we work with a natural or holistic practitioner that can help us to define those things, we can start finding how our body stresses. What are the things that are going to make us stressful, so that we can get ahead of the game, whether it be utilizing things like homeopathy, which is great, using things like acupuncture and Chinese medicine, which are great because these are tools that we can use that are more preventative than necessarily being reactive, because unfortunately in Western medicine it is a more reactive model. And so when we can bring the two together and use them as they should be used, then we can actually reduce the stress from, again, like we've said, medicine and herbs are stressors to the body.
Yeah.
So
Well, some of
using
them
it,
can tonify, some of them are
yeah,
supportive, but
right.
when we're looking at it from like I have to treat a disease, like if
Mm-hmm.
I'm therapeutically going after, like say a patient that is, maybe you're treating cancer and you're utilizing herbs, or you're utilizing even IVs and nutrients, right? The supplements. These are
Mm-hmm.
all stressors to our body at high dose.
Yeah, it's going to cause what's funny is, like iron is an oxidator, it can cause oxidative stress, or it can be an antioxidant. It's all in the amount,
Yep.
because people, and that's where we get into issues, why I really, and I think we may have talked about it another time, I am one to say, I don't want you supplementing without working with a practitioner,
Yes.
because you can cause damage and not even realize it. It may not be, astronomical like with medications, but it can still be a stressor and cause you inflammation. Iron's one of them. You should never do iron without a practitioner, because you can definitely cause issues with your gastronomical or your GI tract, from ulcerations and things like that. Not to mention killing your liver.
Yeah, because too much iron gets stored in the liver, just like copper.
Right. Magnesium, it's going to cause you discomfort. You overdo it.
Yeah.
Now, it's going to cause you GI issues. It's not going to be as detrimental as iron, but it's going to be a discomfort. Vitamin C, it can also be an oxidative stressor. Of course, it takes high volumes there.
Yeah.
But that's the point, is it's
But that's
finding that fine
therapeutic.
line you mentioned, right?
Yeah.
Finding the fine line. And
But I
that's
think
where,
that's the thing that people don't understand. It's like for
yeah,
everything, there is a therapeutic dose that we
right.
are trained to know. And
Right.
using that therapeutic dose, there's usually a timeline because,
Mm-hmm.
it's in my Chinese medicine training that I'm currently going through that we talk about, because a lot of the medicine is about, like we see excess and deficiency patterns. And so what I'm noticing even in my patients, outside of that in my naturopathic practice, is like when people come to me, say that they're taking high doses of said medication or nutraceutical, whatever it is, over time,
Mhm.
there's usually a depletion. And so we have to be working. I fully believe that you have to work with a provider, because you don't go like, yeah, you can learn to take care of your car, but like you still need a mechanic. Like you're gonna call a mechanic when your car is like in need. When that check engine light, unless you're like, oh yeah, you're a mechanic, or you've gone through that kind of knowledge base. But like for our bodies, it's the same thing. Now, there are things that I'm full like, yeah, I want you, like, if you are acute, like you got a fever, you got chills, there are things that you can do immediately to prevent a more intense, or, like more, like to just prevent like the higher need of intervention,
Right.
right? Like, how do we prevent like COVID going into full blown pneumonia kind of things, right? There are ways that like during the pandemic I was able to see, and we are able to utilize things because we're not waiting and seeing what happens. We're like, no, like go get your magic socks, which are like cold. You put your socks in the freezer, they're ice cold. You break off the ice and you put your feet in them, put a wool sock over it, get yourself under all your blankets, and you go to sleep. And that cold is going to make the body essentially cool your feet. So that takes, because we had headaches, right? I actually called you, you're like, do this. But it's like, it took the blood and the heat
From
from,
the head.
and it's allowing it to go down to the feet,
Yep.
because our body is needing to, it's like, oh, I got to cool this area. So then that improves circulation, and that allows for the immune system to work even more efficiently. So there's like little things that we can do, like with hydrotherapy, there's herbs that you can take. Like there are things that are safe that you can take I say in the first 24 hours. I get a tickle in my throat, there's a homeopathic remedy that I'm good at. There are certain things like the
Yeah.
bulbs of spring onions, like save those babies and make a syrup out of it, or make a salad, or make a soup. There's certain things that we can do. Garlic and ginger, those things depend. Peppermint, those are all things that we all like traditionally have been using, and our ancestors have used it. But then when you need more intervention, there's always been doctors, traditional medicine practitioners, who were the people who were called to come and support, because we have the training to actually prevent disease. And when we're talking about stress, going back to the stress, when we're
Yeah.
looking at like the nutrients, too
Mhm.
much, like I see it with B vitamins, like we get stuck on like, oh, I need B12, but maybe you're not balancing the rest of your B vitamins. And all of
Mhm.
our body works as a whole. So when you have high of one thing, then that means that maybe it's low in another area. So then your body is going to try and compensate, and that shows a disease process. And these are stressors that our body is always trying to, because disease, inflammation, all of that, those are mechanisms of compensation.
Yep. Yep. Yeah, that's the thing is our body is trying to find balance wherever we're at. And so stress is just the body's response, or excuse me, stress creates a response in the system to try to balance. And we're trying to do it a lot of times, when we talked about the therapeutic order, we're trying to deal with stress up here in these top places where we're palliating. We're trying to counter the stressors with another chemical, rather than saying, okay, what's driving these actions, that we can pull that away. Again, that, what do we call it? The obstacles to cure, right? Which is the stressor.
Yeah.
Let's go get that obstacle to cure, and we won't have to try to figure out, how do I put this in? Now,
Yeah.
in life-threatening situations, like we said, yes, you're going to do that because we got to sustain you until we can get that stressor out of the way. that
Yes, yes,
underlying that root thing. And then we can balance you and get you back down those tiers until we're back to the bottom where we're doing that preventative stuff. And the best thing, of course, like we said, is to avoid it if we can. Now, we can't always, but most of the time we want to. So getting that balance into place so we don't have, the body gets stuck in a mode. Like, again, if we were talking about earlier, all the different hormones that come out or that have to work in tandem with one another. A certain amount of this, a certain amount of this, and a certain amount of this create this response in the body. But the problem is we've got too much cortisol, which the precursor to cortisol is also your precursor to testosterone and estrogen. They're in the same pathways. And
yeah,
so a lot of times high cortisol causes low estrogen levels, low
yeah,
testosterone levels.
yeah,
Why? Because, well, one of the sympathetic responses is to reduce reproduction. Well,
yeah.
the best way to reduce reproduction is reduce your reproductive hormones.
Yeah, because when you're stressed out, do you want to procreate, right? I mean, that's the
Right.
body's mechanism. It's like times of stress are not the times to bring on new responsibilities. Like if I can't
Yeah,
survive on my own, can I survive with others? I mean,
yeah.
that's how the body is thinking, and you're right. It's like you do see that reduction. But the issue that we're seeing in talking about fertility in that way is a very I think is important because fertility is an issue, and it comes as a part of the stress mechanism as well, and fertility as part of the
Yes.
stress mechanism.
I actually read in research that they said that's the number one cause of infertility now.
Well,
It's stress response. It's being overloaded in in Western cultures.
in a lot of cultures where we're seeing
Mhm.
fertility issues, it's usually
Mhm.
because of the high stress and high pressure society
Yes.
that we are in. And it's
Mhm.
not just like, oh, work as a stressor. It could also be societal expectations.
Mhm.
So yeah, like it's funny because we talk about, in a lot of circles, it's like, oh, and you hear it. It's like, I went through so many rounds of IVF,
Mhm.
and then I had a baby naturally.
Mhm. Yeah.
And you see that
Yeah.
because it's like, okay, like let's kind of go back to let's chill, let's
Yeah.
relax, let's not
Exactly.
put the
Yeah.
pressure on ourselves.
Yeah.
And I kind of, yeah, so one of the so I'm not trying, I was like, oh, I'm trying not to be all hypnotherapy, but one of the fertility
Yeah.
modalities that I use is hypnotherapy for that, because we're identifying the stressors and then
Mhm.
also tying it back, doing regression therapy
Mhm.
to figure out where those pressures, if it's perfectionism,
Mhm.
right? Because
Yeah.
perfectionism is a big drive. Because if
Mhm.
we look at it from a coping mechanism, if
Mhm.
you're a perfectionist, usually you are high ambitious, you have a high drive, you probably are very successful, maybe you're a top student, whatever. And you exercise and you do all the things right so that you can perform at a higher level.
Mhm.
And high performance is valued in our society.
Yes.
So that perfectionism, even if it can be detrimental to health, it doesn't get the same level of attention as someone who has say an addiction to drugs, sex, or money, right?
Mhm.
Because you can actually see pathologically where they can be an issue. Like if somebody is gambling, you can see that it impacts their finances. If you see alcohol or drugs, you can see how it impacts other aspects of their life. But when it comes to perfectionism, what we see are these highly performing people who seem on the outside to have it all.
Mhm.
But these are also the patients that are
Mhm.
coming to us
Mhm.
who are having stress induced illnesses
Yeah.
that present differently. So it's like, okay, yeah, your blood sugar metabolism is not due to overeating the sugar. You need to eat. Make sure you're getting all your meals. Maybe not fast. Don't do all the things that all the media is telling you to do, because
Mhm.
your issue is actually the stress. So let's manage your stress, and then we can manage everything else, because everything else will fall into play. And just to kind of give an example of that, like what does that look like? So again, going back to the case that I shared that got this even thinking.
Hmm.
So this patient was off of work. They're on vacation for, let's say, a week. And during that week, their blood sugar was consistently under 100, like even in the 80s and low 90s. But the moment they go back to work, their blood sugar is over 100. And it's like, it's, I mean, to me, it's clear as day.
Hmm.
So having to have that conversation of, all right, you're the one collecting the data because you're monitoring your blood sugar. But
Hmm.
let's look at what is different on these days versus these days. And if the only thing that's different is that the stressor is your main stressor in life, which when we do our intakes, we talk about that,
Hmm.
then I'm able to say to that person, all right, so yes, I know that. So this patient was in all of the pre-diabetes work, like, groups. And I was like, okay, I actually want you to eat and enjoy your life.
Hmm.
And for you, yes, you can follow all of the guidelines that you're getting because those are just great health tips. But you really need to manage your stress. And these are ways that we can do that. And working with the emotions, because there's usually emotions that help us drive. I mean, like, the most successful people have learned to maybe even, I would say, suppress and use that energy to kind of keep pushing forward. It's like,
Hmm.
oh, I don't want to be, I grew up poor. I don't want to be poor. I grew up with an emotionally abusive parent. I don't want to be that. So, like, whatever it is, and these are things that come up clinically, these are the drivers that our patients are seeing or using that
Hmm.
kind of feeds your success.
Hmm.
Also, what's feeding the disease process, right? So by
Yeah.
reducing that, that helps them a lot.
Yeah, I was thinking about what you were talking about earlier, when you go to cook and to eat and prepping to eat, and help how it can be a de-stressor. And I think this is one of our big problems with, again, going back to spleen chi deficiency and digestive issues and things is, I was reading in Mindful Eating. It's one of my books I have over here. And she talks about 7 hungers. We have 7 hungers that we need to fulfill. Otherwise, our body is not going to properly be nourished and feel satiated. And we talked about taste, we talked about smelling it. And so she says there is your mouth hunger, you have your eye hunger, you have your nose hunger, you have your mind hunger, I think it's the heart hunger, stomach hunger, and I'm missing one. But there's a lot. You're like 7 hungers, yes. And so it's understanding the hungers of the body. And a lot of times we're eating for the wrong reasons. And that's pretty much what she's saying. So, of course, when we're going to eat, and even in what we're taught in Eastern medicine, is getting that when you're eating, you're eating. So there's nothing else going on. You should be focusing on your food. That's mindful eating. And so when you're preparing your food, that's where you get the nose hunger taken care of, right? When you're smelling in the fragrances as you're making the food and you're there present with the food. And then your eye hunger gets when you fix your plate, right? And you take your food and you put it on the plate and make it nice and pretty, like the French do. They have the little garnishes and all the little prettinesses. That's eye hunger. So, and eye hunger could be pretty outside of food, of course. It's when we go out hiking and you see the beautiful terrain and stuff. And if we're just seeing the 4 walls of our offices, our eyes are never getting that beauty, so to speak. So you take in your plate and you see it and you look at it and you say, oh, look at this lovely meal I did. And you feel proud of yourself on the back. And then when you eat it, and that's why you're present. See, a lot of times, why do we eat more than we should is because we're not even tasting it, and chewing it. And so it's feeling the food in our mouth, getting the tastes of all the food as we're chewing it and being present with it. And that way it goes into the stomach. And by that time, we're just eating enough because in the stomach's always yelling, saying, I'm done, done. But everything else is like, no, I'm not. It smells good. It tastes good. I'm nice. This and good. Because we haven't given them the opportunity. We just go and we grab us a burger and we go driving down the road. And the stomach's like, I'm full, but everything's else like, well, I didn't get to see it. I get to smell it. I get to taste it, you know. And then we have the emotional piece of it, right? Then we have the heart hunger and we have the mind hunger that happens. And, intellectual stimulation, interaction with friends. And I was reading, oh gosh, I can't remember where it was now. It was just the other week. It was talking about, it was in one of my books, I think, was talking about why we eat instead of, we're looking for that companionship in relationship. And since we don't have it, the only thing that's our companion is our food. And so to feel like we have companionship, we eat those comfort foods that kind of gives us that relationship of when we, had family, you have family gatherings or friend and you're missing that. So you go for the foods that gave you that, or that was there during those times. And so you're eating to comfort the companionship that you're missing.
Yeah.
And so, of course, that creates the stressors. So now we come back to those stressors that we're using other things, alternatives, rather than the proper way. So it's finding, how do we find the proper balance in like the individual there that's having, finding your stressor, and then we find it in other ways. How do we to manage it to get the stress down? So, making that balance there of being able to eat our food appropriately, making the right calls and knowing, okay, this is a stressor. I'm eating this way rather than eating food for proper reducing stress or creating the stress. I kind of went off a little bit there, but I was kind of going more towards the part like working with them and saying, okay, make your food, be present with your food. And that's be present with anything to help to reduce that stress. Like you were saying, she's realizing when I'm on vacation, my sugar's down, but when I'm not, so how do I, this is my stressor. How do I deal with that? I don't know if we're going to get in that conversation today, but.
No, I mean, honestly, like, that's usually where that's why we work together, right? That's why um, the patients are coming to us to actually be supported by us. Because sometimes it's like, they know that the stressor is there and they just need. I was taught this at National University of Health Sciences, where I graduated from. One of the doctors was just like, look, I have a patient that's a year or two to retirement. And once they retire, they just need to get there. They're so stressed out. And so they come regularly to be supported through that stress.
Mm-hmm.
And then when that person retired, they are like, oh, I'm good. I don't need you anymore.
Mm-hmm.
Right? Because that stress that they were enduring just to survive. Because, retirement is like, oh, once I hit retirement, then I'm getting my pension. And I just need to make it said years, so that is that reality. And that is like the reality for a lot of patients. It's like there is something that they have to just endure for a
Yeah.
set period of time. And by working together, they're able to kind of process what they need, because when we're in stress, we're not thinking. And I see it with my peers, how many doctors they're like, I see it when a doctor's kid is sick, the doctor goes out of the door and the mom is just there, or their dad is just there, the parent is there, just like in their own panic and their sympathetic state. And so that's where it's like, okay, like that's why we exist, because we need each other. Like
Mm-hmm.
I need to go and get my car serviced. I am not trying to be that person doing that. Like everyone, I enjoy cooking, but I also am very intentional, and I do go out to places where I can get the it's not fast food, like I can smell it. I get the eye hunger met, I get the heart hunger met. We get those hungers in,
Mm-hmm.
because it's like walking by a bakery with the smell of croissants or whatever it is. I can't even eat that right. But it's like when I walk by a bakery, just a moment in my heart, I'm like, oh, I remember when I worked at the Boulangerie and whatever in New York, and they had the almond croissants, and I'm like, oh, and in my mouth. So like with visualization and with like so weight loss program that I offer, we actually get there. And I had one client, because I worked with him before I became a doctor. So it was like one client who was just like, I went to a party and there was this amazing chocolate cake and I ate it with my eyes. And I imagined it, and it tasted so good. They actually had the full experience without going
Hmm.
there because they knew that if they had a taste, the full taste of it, that may have been a trigger for them. So they allowed themselves to actually have a full-on experience with that chocolate cake.
Hmm.
They enjoyed it thoroughly,
Hmm.
and they shared with me this experience, but then they were
Hmm.
even more proud of how they were able to be amongst the things that are their weaknesses
Hmm.
and be able to maintain their chill, maintain their health, and not be in that fight or flight, gotta have it, need it to survive. Like,
Yeah.
they were nourished, so they were able to actually sustain that.
Yeah. And that's a, you know, that's where we want to get people, right? Because that is where we're making progress. Because when we can reduce the stressors, when we can understand our stressors and modify them through
Mhm.
visualization or whatever it might be, then we can, you know, because like you're saying, I got 2 years left of school. And I'm like, oh my gosh, it's been in forever. And I know that I have stress responses of going to school because I'm driving up and down the road. I'm trying to do coaching and get my degree. And so it's a lot of stress, and it's coming around my midsection a little bit too much, you know. And I'm like, I gotta get, you know, I'm only like 19% body fat. So I'm a pretty lean, but most, you know, I've gotten a bit more in the midsection, which is attributed to cortisol levels, right? And then cortisol causes an elevation in blood sugar. And then, of course, that creates the insulin response, and the insulin puts it back into fat, and that fat goes to the visceral area or the abdominal area. And so I've seen it trick up being in school, and I'm like, oh, I gotta get this off. But I know it's going to be tricky because of the cortisol levels that I have. And so it's being able to find that support I need during this time, just like anybody. Like you said, we have to find a professional or a practitioner or, you know, others to help us with our stressors and, you know, supplementing, supporting during that time. Because sometimes, you know, again, I was going to state, you know, sometimes you have to get rid of that job. If that job is detrimental to your stressor, you know, if you still got 20 years to retirement, it might not be a good idea to stay there. Now, if you got 2 years retirement, I'm like, yeah, we can support you and get to the end. You
Yes,
know, you've already made it this far. Let's just get you there.
yes,
Uh, Without too much more, you know, so that you can enjoy your retirement. You know, like me, I got 2 years after school, so I just need
you
to be
just gotta
supported and get me there. You know,
yes,
I'm not
you
going to stop
can.
in the middle. But you know, and that's where you have to, you know, kind of take a look at how can I mitigate this stressor because it's affecting my health. And like I had a conversation with a client before about their job, and I was like, you know, this job is very detrimental to your health. You're going to have to look at the benefits of staying or going, or you're going to have to change your mental perception of the job. What is it about the job that's your stressor? Is it something you can manage or you can change, or is it that you're going to have to change your job, your
Yeah,
career? Because that's the thing is that stressor, like we said, this is what this conversation about stress leads to chronic or leads to illnesses.
yeah,
It leads to health issues because we're leaving the stressor on too long. It leads to hypertension. It leads to type 2 diabetes. It leads to cardiovascular disease. It leads to autoimmune conditions. It leads to hypothyroidism because cortisol reduces TSH production from the pituitary gland, which means your thyroid's going down. And you're wondering, why am I tired? Why can't I lose weight?
yeah. And it
And
also
then
leads to cancers
it's
because
cancers exactly because the immune system is debunked or
yeah,
dysfunctional. So, you know, and that's where, you know, you have to start saying, okay, what is my stressor? How am I going to address it? And what do I need to do about it? And I know for me, it's like, I got to get through school.
but there are
It's
so
going
many
to help me
ways.
get.
So from our toolkit, there are things
Yeah.
that we can offer. So,
Yeah.
like for example, people talk about adaptogens all the time. People are talking about mushrooms and all the medicinal mushrooms. And what I have found, because I mean, this is how I made it through ND school, is like I was able to identify which of the adaptogens were
Mhm.
ideal for me, right?
Mhm.
But it's through working with other practitioners, and it's also through studying and all of that that I was able to identify based off of what my patterns are,
Yeah.
which ones are ideal and for what. Like I know a lot of people are they get onto ashwagandha and they're like, oh, I do ashwagandha, but ashwagandha has an effect on the metabolic system specifically. It's a body, it affects the body, and depending on your thyroid function, you may not, that may not be the right one for you. And there also, it's like it depends on, we talk about the yin and yang. It's like people love ginseng. We see it, it's in all it's very popular in East Asian medicine, right? But what we also know is like not ginseng is not the answer for everyone, because there is there are people who don't need it. They actually need something that's more sedating. And but like because again, we're conditioned to keep going, keep going, keep going. They're like, oh, well, it's going to help me keep going. When in reality, what they need is something to balance out that always doing. Because we talk about it, like I know I talked about it when I was educating people in school, like when we were ambassadors, right? When I would introduce people to the school and the education, I'd always say straight up, I, as a student, noticed this. All of my teachers who I trusted, who did well, and they are very successful in many ways, also told me this. When you have like a meditation practice or you have some type of practice that allows you to get into your parasympathetic system and you're less stressed, you're able to retain information more. So when we're stressed, we're not as productive. It's like taking an all-nighter and then going to the exam and you wonder why you bombed. Whereas I believe in sleeping every night. I slept and I'll wake up early and maybe review last minute. Sometimes it didn't work because again, if you're cramming and you can't just cram information, you have to actually study. But like when I study, even if I'm doing high intense studying, I'm doing it in a relaxed state. I'm doing it like there are times where I study with friends or I'm going to go get a meal and then I'm studying. I'm enjoying my life. I may watch a little drama here and there and then I go back to studying, because if I'm not in a peaceful place, all of the information that I'm trying to take in does not stay. It don't stick. It's like you threw something at the wall and it's just sliding down and I'm like grasping for it. And when I'm grasping for things, that means that I'm not retaining, and that's because I'm stressed,
Yeah.
right? So there's a lot like finding out we can use like herbs. There's the adaptogens. There's also like getting acupuncture. That's another way of
Yeah.
sustain. Getting acupuncture regularly, because there are points that help sedate the overthinking and get us back into that relaxed state. Reiki, like I would get Reiki or go to yoga, even cranial sacral therapy, like so many of the therapies. So constitutional hydrotherapy. All of these therapies for me, these are the therapies that put you into that parasympathetic state. And what does that mean? That's like I fell asleep and I was drooling. I like went inside and I was just like, oh, the treatment's over when I come out. Even if I wasn't sleeping, I was just so inside. And those therapies are the ones that allow us to actually like, it's like you took a nap.
Yeah.
When I was studying hypnotherapy, they would say that doing like a short session can be replenishing for a patient who is highly stressed. And especially for like they were talking, it's like mothers who were not able to sleep because they had a little baby. Doing like having these sessions help them to recalibrate. And in that ability to recalibrate, they're actually able to be present.
Hmm.
But yeah, so I mean, like stress is a big issue.
Yeah.
And we do have support systems in place, especially from a natural medicine, holistic medicine perspective, that can help mitigate the stress in our bodies so that we're not carrying the extra weight around our waist, or we're able to sleep, we're able to breathe, we're able to enjoy even and endure the hard times.
Yeah. I guess that brings us to the end of our conversation. I think we've had a great one today.
Yeah.
And I don't know what our next conversation is going to be, but maybe we can get into a little bit more of the stress I would have to say some of the stress management techniques, some of the things go get more into some of the therapies we use with stress management and how we support stress, times of stress. What are some of the nutrients that are very important during that time? Because, this is our day to day. I mean, in Western culture, it is, we are burning up the young. And our young needs some support. But in that, we also have to go after the yin because the yin gets consumed.
Yeah.
You know, talking about the adaptogens, we're taught in Chinese medicine, we have to be careful with that because we can cause pathogens,
Hmm.
things that are attacking our body to go deeper into the system when we shouldn't at certain times. So it's understanding, again, getting back to what's really going on, what's that stressor, what type of stressor is, so we can actually remove that obstacle to cure rather than driving it deeper in. That's what ginseng can do. That's what astragalus can do. And sometimes, what's the other one? Ashwagandha.
But you
Um,
need to work with
Adaptogens.
a licensed, like you should be working with a practitioner who's trained and
Yeah.
can tell you why, right?
Yeah. Yeah. So that you can get the right support you need during those stressful times. Um,
Yes.
so yeah.
Yeah.
Thank you.
Thank you. It's always great to have our conversations in the mindful table. And I look forward to our next discussion. So enjoy, have a good day or evening. Bye.